Hi guys, Dr. Asif here. Wanted to speak about why so many people do not trust Western doctors and Western medicine as a whole. Now we have to understand in the West, the predominant economic model is that of capitalism. Capitalism is a premise which puts profit before anything else. Everything is about profit, whether that's ethical or unethical. It's the antithesis of socialism, where the public own the goods. In capitalism, especially when you get conglomerates and monopoly companies, they own vast swathes of the circulating wealth, and there's a huge disparity between the bottom and the top. Marx talked about this as well. So, in capitalism, when it comes to medicine, the whole premise is to make profit. A patient cured is a customer lost. So, when you mix capitalism with medicine, a patient is treated as a commodity. A patient is treated as a customer. Even in the UK, whereby we have a national health service, it doesn't serve the pharmaceutical industry to cure. It doesn't serve them. If they can keep you on a medication, that's going to help their profit margins. If they cure you, if they prevent disease, they will lose a customer. So it's in their interest to keep you on drugs, to keep you on medication, to keep you in therapy. Now this is the antithesis of Chinese, Ayurvedic, Arabic, Islamic medicine, whereby if you do end up on medication, that's the doctor is at fault. A good doctor is one that doesn't see you. In previous times, in the Orient, you would pay a monthly stipend to a doctor, like a retainer fee, to keep you off medication. The moment you got sick, you stopped paying him. This is the complete opposite of what we have now, whereby you stop paying a doctor once you're sick. And I always say, I've been working in the NHS now for 11 years, coming up to my 12th year. It is not a health service. This is a misnomer. It is a sick service, national sick service. We treat illnesses and diseases which could have been prevented upstream through good education on nutrition, on sleep hygiene, on breathing, on posture, on calorie intake, on hormone optimization, on adequate hydration, on stress control. So many things which we could have been taught at school, but we weren't, so we end up on pills and potions. This then drives the capitalist cog of increasing profit. One thing I learned at medical school, and actually was the oath I had to take when I became a doctor, was first do no harm. This, however, in the West has been completely lost because we now do harm with medication. They say now it's all about first do farm, PHARM, first do farm. Instead of not committing harm, we are harming patients by getting them addicted onto drugs. Look at America, for instance, Valium, sleeping tablets, some strong analgesics like OxyContin, oxycodone, propofol, fentanyl. These have killed celebrities in the past, like Prince, Whitney Houston, Michael Jackson. So many celebrities have had overdoses from prescription medications for pain and sleep and anxiety. Why are we throwing drugs at people like Smarties? That's my main question here. A lot of doctors are to blame for this because they do not critically assess, they do not evaluate. The main issue I have really is because doctors do not evaluate, they are left in limbo as to their employer. They have to have some sort of boss says yes approach. So they just give out medication like Smarties. Because they give out medication like Smarties, they do not critically evaluate the side effects, the downstream side effects of this medication, namely addiction. So a lot of people are going away from Western medicine now and looking at alternatives like Peruvian, Andean, Incan, Mayan, Chinese, Ayurvedic, Arabic, Islamic. And for me, this is a counter narrative to what the West is pushing. Like, you go to see a doctor now and you say, I'm not sleeping. They'll give you sleeping tablets. You say, I've got a headache. They'll give you painkillers. You say, I've got back pain. They'll give you more painkillers. We're very reactive, not responsive. And because we are reactive, we do not see, or we do not have time rather, for the upstream preventative aspects of holistic medicine, which is dietary control, proper nutrition, sleep hygiene. We do not have time for this. And our doctors are so pushed. This is why people are getting away from Western medicine. They're realizing medicine in the West is all about profit margins. It's all about pills. It's not about prevention. It's not about well-being. It's about sickness, not about health. So a lot of people are going to alternative medicines. The second reason why is if you look at your doctor, your normal doctor. This is why I left medicine. I saw people around me. They were out of shape. They were significantly younger than me, but looked significantly older, out of shape. Men had breasts, gynecomastia, what we call it, from high estrogen, from high cortisol, high prolactin levels. Men couldn't build muscle. They were just skinny, aged, grey, battered, bald, in their 20s. I'm like, what is happening here? I don't want to be like this. I do not want to be a shadow, a shell of a man because of my career. So I decided to leave medicine full time and concentrate on wellness optimization. And that's exactly what I do at AM Wellness. I coach, we have supplement range, and we do blood tests on clients who want to optimize and get to the next level. So if you are interested in one-to-one health coaching with myself, Dr. Asif, or our bespoke range of supplements, which you've probably seen before on Dragon's Den, or our blood tests, which check for A to Z, all the way from aluminium levels to zinc levels, anything in between, particularly ferritin, testosterone, folate, vitamin B12 deficiency, vitamin D deficiency. These 4 or 5 things are so important, and they are lacking in men. And zinc and magnesium. And a lot of men are calcium deficient because they've gone on some stupid vegan diet. So get your bloods checked, book one-to-one health coaching. I can really help you in your journey towards becoming the best version of yourself.